legal responsibility you can have for a data breach, right? Unlike so many other laws, it's not really vague. It says that you can have fines, and the fines scale depending on how many people are breached and exactly what's going on. And yet, even with those teeth, it doesn't seem to get the message across to providers, to companies. It's not scary enough. And so, one of the things that we try to recommend to our clients is to think about security, not just in terms of your HIPAA compliance. And by the way, we do audits security audits, test audits of clients, not just healthcare providers, but their vendors. And they promise security, they advertise security, and we come in and we test them and we find they're very much not secure. They have kind of nominal HIPAA security. And so what we recommend to them is to do a more legitimate, more real enterprise security assessment. If you guys want to talk about that.
From our perspective, when it comes to mobile devices especially, one of the first things we would recommend to anyone, like what's the first step we can take to make sure that from the mobile device side things are locked down as they should be, is we would recommend encryption both at rest and in motion. So you all have corporate computers that when you boot up you probably have to put some PIN sequence into. That is known as device encryption. So if you lose your laptop or it gets stolen, you leave it in an airport, no one can turn that on and access your data. But once you've turned that on and entered that PIN, the data on your device is now in motion and can be stolen. So we recommend file encryption from that side. So you have, at the most basic levels, you want to make sure that things are encrypted because, as Mark said, once things are in motion, they can be plucked, they can be stolen midstream, and so that's some of one of the best things you can do as far as being compliant is to show that any sort of data you have on customers is encrypted, so that even if it does get stolen, it's still locked down. It can't be accessed by third parties.
I think one of the things that's really important for everybody in the room to do is understand whether what you're doing requires to be HIPAA compliant, and if it does, what you need to do to make it HIPAA compliant. So if you're not thinking about that already, which hopefully you are, but if you aren't, there's plenty of resources available to everyone to understand what the requirements are and what the thresholds are to make something require something be HIPAA compliant.
Well, Mark, building on that, so we have a room full of folks who are interested in the medical space and sensors, many working on it. We have many engineers here. And when we start to talk about designing new systems or new products, who actually owns the security and privacy part of that continuum? Is it the engineer? Is it a privacy officer? Who is it? And who should be taking responsibility for that?
So from a total system standpoint, it depends on whether the HIPAA compliance is actually at the endpoint or the device, or whether it's on the cloud. And that's really determined by what is being done on the device, or on the mobile device, or on the sensor device, and what's being done on the cloud. But at the end of the day, there is liability associated with something. And Guido, you might want to comment what the state of the law is today about that liability.
Sure, actually, I plan to talk about that a little bit more in terms of, so I'll jump to that quickly right now. In terms of liability, right, so there's there's regulatory liability, there's the law that's out there, right? And one of the things about laws that come out, right, so HIPAA is very clear. HIPAA makes it very clear who's liable for a breach, who's responsible for protecting data, and then through things like business associate agreements, that trickles down to the different parts of the organization, right? But new laws will come out. After my last conference, I was approached by 2 New York State senators who are working on a new law in New York State that would make companies more directly liable for security breaches, right? But that law is going to come out, and the law is going to be vague. It's not going to say you have to use this type of encryption or you have to use Bluetooth 4.1 or blah, blah, blah. It's going to just require security. I think that how the liability actually shakes out is going to be more in contract, which I have some slides on. We can go into that a little bit later.
Do you want to do that now? Or?
Let me address one thing real quick. about, in terms of, because the question was about design and security, right? So who owns it? Well, in terms of design and security, it's more, for me, I guess to answer a slightly different question, is about what you should be designing for. So there were 3 recent hacks, 3 recent security incidents that happened that I think are illustrative of this. So first, in terms of Internet of Things, IoT problems, it was the Dyn attack, right? So that happened a little while ago. Internet of Things devices, baby monitors all over the place, they weren't being updated, they had the default passwords on there, maybe some of them could not be updated. The point was that they were accessible, hackable, and very easily turned into a botnet, and there was no way to get them back. And so as a result, they would turn into a botnet, DDoS attack, and then half the internet went down from the user's perspective, right? Why did that happen? Because somebody didn't design them correctly, and also because people did not take the time to update their passwords. There was the Amazon Web Services outage that was caused by a typographical error, right? And then there was the issues with ransomware last year, where a number of hospitals got taken offline, not because anyone was trying to take their medical data, just because somebody clicked a virus that was enabled the hacker to put ransomware in the computer. The common denominator to all these things is that people are the attack vector is not hacking your encryption. The attack vector is to go after the people that will make it possible for you to go after something else, right? So the problem, for example, the ransomware, the reason why that was problematic was because the internet-connected systems that were vulnerable, where the administrative staff gets a forward email and oh, that's a cute picture of a puppy and clicks it, right? That was not sufficiently separated from the MRIs and the surgical support computers and things like that, which is what knocked out their network and made it impossible. I mean, ironically enough, the ransomware, the process of that is it actually encrypts the network. So if anything, they're more HIPAA compliant now, right? Because all their data is re-encrypted, but it counts as a breach. Bottom line to this whole long-winded thing is that I think you have to design for people to be your weakest link, and maybe take a role with, if you're a provider here, if you're a healthcare provider, incorporate that. And if you're a vendor seeking to sell devices to these companies, to these providers, maybe you have to take a role in that too to make sure they have the things set up properly.
We have a bunch of labs all over the world where all our data flows through, so we can analyze the threats that are coming in, the attacks that are coming in. And we found that the #1 target for ransomware attacks are hospitals. The quickest to pay are hospitals. And followed closely by law firms, Guido. So
we don't report it though.
You don't report. So, because it's the data that's located inside any sort of medical setting is so valuable that it's easier to pay up quickly if you're a hospital that's not protected against ransomware. That the amount of time it would take you to revert your systems back into working order far outweighs the ransom payments. So you see hospitals getting hit, paying the ransom. We've seen a couple of cases of hospitals paying the initial ransom and the attackers coming back and saying, wow, you paid really fast, we're going to double it now, pay some more. So any sort of medical setting that has any records or meaningful data is a huge target for attackers.
I think Guido made a very valid point. The weakest link is still the people in the system. And so you can't rely on the consumer, if they're using your mobile healthcare app, to do the right thing. At the same time, you can't make security intrusive to them. This is one of the things that we learned in the financial sector, is that it has to be easy to use but also secure.
In terms of the ransomware, right, so we know that hospitals are, if we know that hospitals are a target of something like ransomware, what do we do about it? Well, we design for that problem. So there should have been disaster recovery plans. There should have been backups, but not just having backups. There should have been some kind of tracking to know when the backups took place and a way to know whether or not the backups were compromised, things like that. So they could have told the hackers, no thanks, and just reverted to a backup, taken internet access away from the people who clicked the links in the first place and been back up online, instead of, I think it was in Kentucky where they paid and then the hackers asked for more money immediately. Right?
Kentucky, LA did too.
Right. Yeah.
So from a patient perspective, right, we're sharing all this data in these devices. What what can patients do, or can they do anything in terms of helping to secure that information, besides just not doing?
Again, I wouldn't put the expectation that many patients will secure their own data. They're not used to securing their data in the banking and in the retail space, and so why would that apply to the healthcare space? It's really the liability for that is on the healthcare providers and the system suppliers in that. I mean...
Right. So what do you, Doug, you're also a patient, right?
Yep.
And so from your perspective, what does the security of self-managed healthcare look like in the next 5 to 10 years?
I think I'm a type 1 diabetic most of my life, so I've been, using insulin pumps and continuous glucose monitors. It's been a struggle between me wanting things to move more quickly and making sure that all my data is safe. But I see a quick diabetes. Basically, I have a pancreas. It doesn't work. Lazy. When I eat food, my blood sugars go up. I manually inject insulin to bring them back down. Your great, well-working pancreases push the insulin blood sugar levels back down. So you have great pancreases. Mine is a deadbeat. So they invented all these gadgets so I can manually inject insulin without actually doing an injection. That's the insulin pump. So I see in the future a closed loop system that they're very close to perfecting anyway, wherein when my blood sugars go up, this pump kicks into motion and brings my blood sugars back down automatically. That's great. But I'm a busy person. I would like to, in 5 years, once this system has been perfected, completely outsource my diabetes care to someone else. Like a junior level doctor sitting in front of a bank of maybe 10 monitors, 10 patients, and this person monitors me all day long and has access to my calendar, knows if I'm going into a meeting or a presentation, has access to my heart rate, knows if I'm exercising, has access to my location, knows if I'm in a bar and I'm drinking, knows if I'm traveling, that kind of stuff, so that I can completely outsource all of my diabetic care because I don't want to worry about it at all. So we have these algorithms now that will sense my blood sugars going up and then push them back down. I want it to be proactive. I want to pay $100 a month for this service, something like that. Obviously, those are huge privacy implications because you have access to my location, you have access to some of my financial data. I want this person to reorder insulin for me when I'm getting low. You have access to basically my entire life. So huge privacy implications. But from a technical standpoint, all of this is possible now. It's just that we haven't worked out the security side of it. We had problems with battery issues. Those have mostly been taken care of with Bluetooth Low Energy, that kind of stuff. But this is the privacy and security is a huge roadblock to this kind of advanced medical care being a reality where I can just outsource my care. And then after that, 5 years later, it's all artificial intelligence, so I don't need a person there, but I want a premium concierge service.
Well, when you work in this industry, you and I, Guido, you tend to be paranoid because there's so many attack vectors for the cyber criminals to do. There's, besides just breaching a mobile system, there's credential stuffing and there's, man-in-the-middle attacks, and there's all kinds of different ways for a cyber criminal to steal the information. All they need really is the credentials for the mobile app or the online mobile portal, and then they can access any patient data.
Not only my data, it's at some point, this person far away, this person that's managing my diabetes care for me is remotely administering insulin to me, right? Or backing off if my blood sugar is going down. All it takes is someone to get in there and say, I've got your insulin pump, we've got ransomware installed on it, pay 10 Bitcoins to get your insulin back. That's a huge, scary reality that we're starting to kind of see proof of concept ransomware in medical devices. So that's something that's on the horizon in the next 3 to 5 years, definitely.
So now that we've scared everyone, how do you promote the adoption of medical sensor systems by designing in-security features at the outset? Mark?
Well, there's many things that can be done from the standpoint, Doug mentioned encryption, making sure that the whole system is secure, and also from the standpoint there's false apps out there or false websites out there or ways to circumvent that. And there's very, very many different ways of securing these things, from code obfuscation so that the cyber criminals can't replicate or steal your intellectual property as well as your customers' information. So there's a lot of different ways of doing this. Certainly if you're using a mobile app as a portal to the cloud, you want to make sure that all the data on that, there's several data leakage protection solutions available for mobile apps. You want to be able to implement one of those into your mobile app, because you can't depend on the device of the user practicing best practices. And then if you're also taking the responsibility for the cloud, and even if the cloud is HIPAA compliant, you have to make sure that that data is secured through the cloud through a lot of the tools that companies like Doug's sells.
We also see a lot of, it takes a far longer time to update medical devices because of how sensitive the operating systems and code and stuff are on the devices. And we talk a lot about signed firmware versus unsigned firmware, and it takes longer signed firmware is a safer update route, but it takes longer to get those kinds of systems into place. So something, and we don't have I don't think we have the answer to this quite yet, but how do you quickly get updates out to devices that are vulnerable?
Right, and we're starting to apply, well, your company is one of many companies that are starting to apply advanced deep learning, artificial intelligence to be able to detect network anomalies and detect breaches.
So Guido, I think you wanted to share case studies, right?
Sure,
The clicker.
Set it up. So, as the lawyer in the room, or one of the lawyers in the room, I thought maybe one thing that you guys might not be familiar with would be the actual contract negotiations that go along with this kind of thing. So, I imagine there are a lot of startups in the room, some big companies. Ultimately, no matter what you promise to your customers, and no matter what's promised to you as the provider, it all comes down to what's in the contract. Okay, which I'm sure many people never even bother reading. Lawyers put in these extreme terms. So what I was saying before is, I think that a lot of the who's liable for what is going to come down to what's in the contract. And I wanted to share an experience that we had recently with a vendor that was actually coming to to us as a company. But this is very similar to everything else. So I'll go through it real quick. I don't want to take up the whole presentation, and then I'll give some recommendations, right? So, as general counsel, my job is to protect the client. My client is my company, right? And to make sure that the contracts are fair. So, first red flag here, okay, is, you can see the red underlined here. We accept all risks associated with providing our data to this company. Now, this is not, I blacked out the name of the company here, but I imagine that many of your contracts say the same thing, because your lawyers probably used a very similar contract and they say these things. And the purpose of this is to let you know how extreme they are and what pushback you're going to get. So first here it says, we accept all the risks associated with giving them the data. Okay?